Today, we're diving into Kava, a drink from the Pacific Islands with a story that is just full of contradictions. You see, for centuries, it's been this sacred cornerstone of tradition. But now, it's also a trendy wellness product caught in this huge web of scientific debate and regulatory confusion.
With Kava bars popping up in cities all over the world, we're kind of forced to ask a big question. Is this a cherished cultural practice that we should be embracing? Or is it a potential health risk we really need to get a handle on? That's the central conflict we're going to unpack.
So what is kava exactly? Well, at its core, it's a drug made from the root of a plant. It's technically a depressant, which basically means it helps you relax and feel calm. But, that simple definition doesn't even begin to scratch the surface of just how culturally important this plant really is.
To really get this, to really understand the controversy, we need to explore the two completely different worlds that kava lives in. You've got the world of ancient tradition, and then you have this new world of modern commerce.
So on one side, kava is this incredible cultural cornerstone. It's used in the biggest life events, weddings, funerals, you name it. It's a way for people to connect, and it's a core part of Pacific Islander identity. And then on the other side, it's a global commodity, processed into pills and supplements for anxiety. And for countries like Vanuatu, Fiji, and Tonga, it's an absolutely critical export.
The authors of the big review we're looking at today say it perfectly. They state, kava holds social and cultural significance and is an essential trading commodity. So this is not just some casual drink. It is woven deep into the social and economic fabric of these nations. The stakes here are just incredibly high. And all of that cultural and economic importance, well, it sets the stage for the real heart of the conflict, this intense debate over what kava actually does to our bodies. And this is where things get really complicated. Yeah, when you actually dig into the science, there are no easy answers. The researchers who combed through decades of studies, they found that the evidence is completely, totally divided. For example, on one hand, the review found 37 different scientific records that pointed to the potential benefits of using kava. But then, get this, they found 72 records reporting potential harms. That's almost double. And that imbalance alone tells you that the scientific community has been really, really focused on the potential risks. So let's break down what they found on both sides. Okay, so the biggest argument for kava is its effect on anxiety. The review looked at 8 randomized controlled trials, the gold standard of medical research, where kava actually produced a significant reduction in anxiety symptoms compared to a placebo. Other studies pointed to improved mood, relaxation, and better sleep. Some even found that it was generally well tolerated, with very few serious side effects. But now let's flip the coin. The most serious warning is about liver toxicity. The review found 31 records that linked kava to liver damage, and some cases were so bad they required a liver transplant. I mean, that is a terrifying risk, and it brings up a huge question that a lot of researchers are asking. Could the way kava is prepared be the real issue? Traditional methods use water, but some commercial supplements use chemical solvents. That difference might just be a key piece of this whole puzzle. Other reported harms include a scaly skin condition, impaired driving ability, and in really heavy users, even malnutrition. So you have this promise of a natural way to deal with anxiety and stress on one side, and on the other, you have these stark warnings about really severe health risks. With data that's so all over the place, I mean, what are governments and regulators even supposed to do? Well, as you can probably guess, all of that scientific confusion has led directly to a completely contradictory and, frankly, confusing global policy puzzle. Just look at this timeline. Back in 2002, reports about liver damage led Germany and the UK to ban kava products. But then, just over a decade later, Germany completely reversed its ban, saying the evidence just wasn't strong enough. Australia has gone back and forth too, and recently relaxed its rules. The result today is this global patchwork of laws that creates confusion for everyone, consumers, importers, and the Pacific nations that depend on it. So, after going through the culture, the health debate, and all the policy chaos, where does that actually leave us? Let's go back to the source, that big systematic review, to see what the researchers ultimately decided.
And I really want to pause here for a moment because this shows you the incredible rigor behind what we're talking about. The research team didn't just glance at a few papers. They started with almost 3,000 records and then meticulously screened them down to the 197 most relevant studies to draw their conclusions. This was a massive, massive undertaking.
And after all that work, their first conclusion was crystal clear. Kava is, without a doubt, profoundly important to the culture and economy of Pacific Islander nations. That part is not up for debate. But, and this is the key takeaway here, when it comes to health, the final verdict is that there is no verdict. The evidence for both its benefits, like anxiety relief, and its harms, like liver damage, is still scientifically unclear. The researchers concluded that we simply need more high-quality studies before we can say anything for sure. And that leaves us with one last, really challenging question to think about. When something is so deeply woven into the identity of a people, but it remains a total scientific mystery to the rest of the world, how do we navigate that? How do we create fair, sensible policy in the face of such profound cultural significance and such deep scientific uncertainty?